It's great to be here on the Gold Coast and of course another satellite hospital. But before I start, can I also to acknowledge the traditional lands on which we are today gathered, and thank Craig for his lovely warm welcome to country. So today, of course, we're continuing to talk about our satellite hospitals, and this is the fourth sod turn that we're doing. We want these up and running within 2 years, which the Health Minister is on track to deliver. This is the Tugun Satellite Hospital, and of course I'm joined by our Minister Megan Scanlon, who of course is our Minister on the Gold Coast. I know how she's been very passionate about driving this project as well, because once again it will help alleviate some of the pressures here on the Gold Coast. So this is one of 7 satellite hospitals. It's the fourth sod turn that we're doing. There'll be about 30 people here on the construction site. I want to thank Scott Hutchinson also for joining us here today as well. Just up in Ripley the other day, where there's a school and a satellite hospital being built. So we know that where there's growth areas, we need to do this infrastructure. And of course, driving down the M1 today, lots of work happening there as well. So of course we're expanding that M1 highway as well. So it's on track to open in 2023. The health services that will be offered will include treatment of minor injuries and illness, renal dialysis, pathology, ultrasound, medical, allied health and maternity services as well. In addition, of course, we'll be building on the Gold Coast a brand new Coomera hospital, $1.3 billion. And of course, we know how many families are moving into that northern end of the Gold Coast. So today we're on the southern end, and of course, over the coming weeks, we'll be up on the northern end talking about that as well. Now, before handing over to the Health Minister, I just want to mention too about COVID. I know that it's on everybody's mind at the moment, and of course, people are talking about the rising COVID numbers. The third Omicron wave, which is having an impact on our hospitals because so many of our hospital staff are either sick with COVID or sick with influenza. But also too, now that we've been given the green light for those fourth jabs, those fourth boosters, I'm really urging people over 50 to get their fourth booster this week. And I'll be trying to book in either this week or next week to get mine. So hopefully by me doing that, it's sending a signal to everybody else across Queensland that they should be getting theirs as well. And I'm quite sure the Health Minister will be as well. So the fourth booster is available to people over 30. But of course, we're seeing the people who are ending up in hospital with severe illness are those over 50. And of course, the statistics coming out about the people who have passed away from COVID, 91% are over 65. So really, if you're 65 and over, seriously book in, get that fourth dose, but also too, strongly encouraged if you're in that age bracket, seniors in our community, to think about wearing masks in crowded spaces. Also too, schools back today too for thousands of students as well across our state. We wish them all the very best with this term. And of course the school holidays has also been a huge windfall as well for our tourism sector. Reports of lots of accommodation booked all the way from the Gold Coast up to Port Douglas. Okay, so I'll hand over to the Health Minister, but I should mention there are 782 people with COVID in hospital, 671 public, 111 private, 10 are in ICU, 4 are ventilated, and we have 104 new influenza cases that are in hospital as well. Okay, I'll hand over to Yvette. Thank you.
Thank you, Premier. It is wonderful to be here at Tugun for this sod turning of one of our 7 satellite hospitals across southeast Queensland. These satellite hospitals will help ease pressure off our hospital system by taking away services that don't need to be in our major hospitals, but also to give the community somewhere closer to home to come and get that care. As the Premier said, people will be able to come to a satellite hospital like this one being built here on the southern end of the Gold Coast for minor injuries and illnesses, outpatient services. We're looking at community-based services as well, some more health in the home, and supporting that from a site like this. If we can do that, it means that people don't need to travel further to get to those major hospitals for healthcare that they do not need in those big hospitals. I want to acknowledge Megan as well on the Gold Coast. I know we tried to do this a few days ago. The rain got in our way, but we are here. The sun is out, and we are so excited that these satellite hospitals are getting underway. These hospitals will be completed by 2023. And as the Premier said, we're in addition building a new hospital at Coomera over $1.3 billion, but also we're adding an extra 70 additional beds at the Gold Coast University Hospital, $72 million investment, which will be operational late 2023 as well as part of our modular expansion, because we know we need to be investing beds now, but also planning for the longer term and the growth in the region, and that's what these facilities will do. And part of that over $9 billion investment in capital infrastructure across this state, as well as a budget of $23.6 billion of operational funding across our hospitals. I know that we have the board chair here from the Gold Coast Hospital and Health Service, and I just want to acknowledge all of the tremendous work being done by our health staff, including those here on the Gold Coast. I know the Gold Coast is seeing a surge in COVID cases again. The Premier has just talked about how many cases we have across our public and private hospitals right now. I also want to say we've got 2,337 staff that are off with COVID alone, let alone other illnesses. That is putting incredible pressure back on our health system, with so many staff furloughed, as well as so many COVID patients in hospitals needing our care. So I thank those health workers who come to work each and every day to make a difference and to care for those people, and also ask for everyone's patience and respect of our health workers who are doing such a difficult job and such a tremendous job in difficult times. Thank you.
Thank you. There you go.
Thanks, Premier, and thanks, Minister. Great to be here on the Gold Coast today. I was just reflecting on a conversation I had with Ian just a couple of weeks before the budget with the wish list, and I think we've been able to deliver everything that the Gold Coast was asking for. Of course, we know the Gold Coast is growing and growing, so it's really important that we keep up with that demand. Since coming to government, we've delivered an increase to the budget of 82%. Thank you. 82% increase to the budget since becoming elected, and this year's budget will deliver a record capital investment. As has been mentioned, numerous beds across the Gold Coast, 608 beds in fact across the total Gold Coast. That's in addition to the satellite hospital that we're at today, as well as the 40-bed mental health rehabilitation unit that we committed to during the election. And I want to make a specific point about those two projects. Those two projects were projects that we committed to during the election that the Liberal National Party did not match. So if the Liberal National Party were elected today, there would be no satellite hospital and there would be no mental health rehabilitation unit. I'm very proud to be a part of a Labor government that is delivering when it comes to healthcare here on the Gold Coast. We're the party that built the Gold Coast University Hospital, and we're the party that's delivering both the Tugun Hospital and will deliver the Coomera Hospital as well. So a really fantastic day to turn the sod on a really important project. As has been mentioned, this will take a lot of pressure off our existing hospitals, both Robina and Gold Coast University Hospital. In fact, it's the busiest emergency department in the country. So this investment is critical, and we're delivering it because we know that our growing community needs it. Thank you.
We're happy to take some questions.
Yeah, Premier, in terms of the amount of new beds available once all these hospitals are up and running, is there any modelling with regards to exactly how many patients will be diverted from ED departments already under stress across the state?
Well, the modelling has been done in terms of the timing of when the satellite hospitals and all of our new beds come online. That's why we have announced the largest expenditure, $9.7 billion in hospital expansion right across Queensland. And as you can see, a lot of this is happening on the Gold Coast. It's a growing community, and the Gold Coast is getting a brand new hospital.
Are there any specific numbers at all that you can give us in terms of exactly how many patients roughly that could be, or percentage-wise?
Well, the state's growing, and there's going to be an expansion of beds, and the health department has done the modelling to look at when the beds are needed and where the beds are going to be put. So that's what we've been doing across the state. And we've been across the state, the whole cabinet's been out there talking about our investment in healthcare.
And you've also just mentioned, with regards to COVID, obviously, we're seeing another big wave here in Queensland. I understand you just mentioned that thing about the fourth dose, and fully respect that, but also Queensland has got very low numbers of getting the third dose in the first place. Do you think more could have been done by the government to encourage people to get those first boosters?
We went out across the state to get people vaccinated, and that's why Queensland had a record low number of deaths over 2 years, because Queenslanders went and got vaccinated. Now what we want to see is more people go and get that third dose and that fourth booster. We know that it's incredibly important. This is about keeping especially our senior population safe. So I'm really urging our seniors to go up there, roll up their sleeves and book in with their GPs to get that fourth dose.
Premier, hospitalisations are their highest point they've been in 6 months. I think you said something like almost 800 people are in hospital with COVID. When we've got school back now, which brings increased risk, state of origin as well, what is the trigger point for when public health measures need to come back, and do you have a plan in that case?
Well, we addressed this the other day, and Dr. Gerard spoke to the media at length about this, about it's people's personal responsibility, okay? So if you're in a crowded area, it is your choice to put on that mask. But what we're seeing is the people who are ending up in hospital, and tragically the people are losing their lives, are people over 65. So if you're over 65, the best thing you can do is to get that fourth booster and to be thinking about wearing a mask to help prevent that spread.
Premier, while we're on COVID, is Queensland Health at the moment reporting reinfection numbers?
I might get the Health Minister to address that one. Yeah. Okay.
Can I just ask you just about the coral princess? Are we concerned about the number of cases that we're seeing amongst staff on that?
I'll get the Health Minister to talk about that. Is that right? Thanks.
I've received information around the Coral Princess, and there are protocols in place. So before the cruise line started back up, there were protocols put in place as to what would occur if there was an outbreak. We are seeing an outbreak, and I understand passengers and staff have been advised of that, and anyone who is due to embark, I believe it was yesterday or today, from Brisbane, are also advised what is occurring, so they can make personal decisions as to whether they want to go on board or not. Some of those passengers are being removed. They have chosen to isolate either at home or in other accommodation, and we've supported them in doing that, and we're managing the staff that are infected now. This was always going to happen, just like the rest of community. The virus is everywhere and there's no escaping that, but I do want to acknowledge that the public health units, along with the cruise line, are doing all the right things and following the protocols in place, and they will be testing staff more frequently at the moment, and also encouraging any passengers who have any symptoms whatsoever to come forward and get tested, and they still will need to isolate as well. So I am pleased that all of the proper processes and protocols we put in place before the cruise line started back up is being followed in this situation.
Minister, just on that question about reinfection.
Sure, yes.
Are we at the moment reporting reinfection numbers, and if not, why not?
Yeah, so look, I'm happy to follow up with we're recording reinfection. The challenge is that most of the reported infections of COVID nowadays is done through rapid antigen tests. So people doing their own tests and recording it on our public website. We haven't in the past been asking people to report whether they've had it previously, because then you start needing to look at, well, when did they have it? If you want to actually make the data useful, how long ago did they have it? Was it Delta that they had? Was it Omicron that they had? Which variant did they have? What we do know, though, is that the health system, when they are doing PCR tests on those who are seriously unwell and needing hospitalisation, they are checking that history and collecting that data as well. But the message is clear to everyone. It doesn't matter if you've had COVID. You can absolutely get it again. And what we do know about BA4 and 5, the new sub-variants of Omicron, is that we are seeing reinfection. And that can happen quite quickly. So it can happen within the 12 weeks that we have talked about previously. So anyone who is getting any of those obvious symptoms of COVID, whether they think it's just flu or not, I still strongly recommend that they take a rapid antigen test because they should isolate themselves. The main way we can reduce the number of cases out there right now is people not spreading it to other people in the community or their workplace or even in their household. So the sooner you know you have COVID, isolating yourself within your home as well, so you're not exposing other family members, and importantly, not going to work. Do not go to work sick. And as the Premier has said, both her and I are now eligible under the new criteria to get vaccinated for the 4th booster, and we'll be doing that. And I look forward to making my booking in the next few days to get that 4th booster. If you're due for your 3rd, come out. I'm so proud of the work that the Palaszczuk government's done, that our first doses of COVID is over 94.2%. That is extraordinary to have that level of vaccination across our community in just over 12 months. What we want to do is see the booster at the same rate. And everyone has free access, easy access. Community pharmacies and GPs, go and get your shots, whether it's your 1st, 2nd, your 3rd booster or your 4th booster, because we know it makes a difference.
And just on that reinfection, will Queensland move to a 4-week reinfection cycle?
Well, we follow the advice from the AHPPC on that, and that's what we've done all along around that 12-week rule. That was the advice of the chief health officers across the country, and we'll continue to follow that advice.
Is there much concern with schools going back now in the middle of this wave about cases skyrocketing?
Look, we're seeing COVID widespread across the community. The schools going back is no different. What we do know is that, it's 50 plus, as the Premier said, 97% of those who end up in our hospital have been 50 plus. So we do know that the risk is greater the older you get with COVID. But again, my message to parents is there's vaccines available, they're free, they're safe, and also that we want to make sure that if the child's sick, please don't send them to school, because then they risk spreading it to other children, to the teachers, to the staff, and to other families. So we know what to do. Good hand hygiene. Wear a mask if you're particularly vulnerable. Stay home when you're sick and get vaccinated. 4 easy things that we all can control, make decisions ourselves to make a difference to keep everyone safe.
Sorry, back to the
Yeah.
do we have any numbers of how many of those staff have been tested for patients?
I'll be able to get those numbers for you. Yeah.
And also with this new satellite hospital, do you think that these ones being built across the state are going to help with ambulance ramping as well?
Well, everything we can do to create additional space to expand bed capacity in our major hospitals will help. Because what we know is it's not about the number of paramedics and ambulances we have on the road. It's about, can we get people into beds? About 30% of everyone who walks into an emergency department on any given day need to be admitted. They either need to go to surgery and then onto a ward or straight onto a ward. That means we have to find that number of beds at the same time as dealing with elective surgery. And we don't want elective surgery to have to keep being suspended to deal with those emergencies. So by shifting some of these services and getting people to go to more locally based services like these satellite hospitals, we know that's going to make a difference to be able to treat patients quicker in ED, but also to create extra bed capacity in the hospital system.
And obviously this hospital's really going to help with that, but do you think given COVID is running rampant again, do you think realistically it's going to take years for that elective surgery wait list to come down?
Well, that's why some of the announcements we've made with the over $7 billion of investment includes building what we call cold hospitals. So building whole new expansions of hospitals that only do planned care. So we have operating theatres and wards that are only for planned care. That means they're not being disrupted by the 30% that are coming in through the ED door. And that helps us not have to constantly have those delays happening through the elective surgery system. So new models of care, new innovation, helping people stay home longer and treating them in the home. All of these initiatives combined, including what we're doing with mental health and the co-responder model, will help make a difference in that demand pressure on our hospitals.
Yep. Yeah, sure.
How many people are actually in that facility
I don't think there's any there at the moment. About 670 have been through there. But let me say this: there have been purpose-built quarantine facilities right across the country, and the one in Toowoomba is no different to one being built in Perth and in Melbourne, and now even Howard Springs is not accepting any more people. So we are future-proofing our state and our country for what could be in the future. I can't predict the future, you can't predict the future, but we are prepared.
So, I guess with the lease stay on that facility with the state government?
Sorry?
Would there be any changes to the leasing arrangement?
You'd have to check with the Deputy Premier. Yeah.
Are you in favour of public drunkenness and begging, among other offences, being decriminalised in Queensland?
Okay, so look, in relation to that, there is currently an inquiry that's happening. So people are free to have their say. But this was a recommendation that came out of the Black Deaths in Custody report. And Queensland is the last state to actually remove this offence. So I would encourage people to have their say on these particular measures.
So is saying more attention to be given to the causes of these offences. Do you agree?
Oh, of course we are supporting our community organisations out there, but as you'll see, people from the Law Society are even commenting that disproportionately the number of people that are being charged are Aboriginal and Torres Strait Islanders. And if we are going to be pursuing treaty and reconciliation, I think these measures that have been adopted everywhere else in the nation except for Queensland, and now Queenslanders have their chance to have their say on these measures.
Premier, in relation to
Yep.
the Pinkenba quarantine facility,
Yes.
what's happening there?
That's being run by the federal government, so you probably have to put those questions to the federal government in relation to that particular facility. Yeah.
Can we just get a quick word on the State of Origin? How are you feeling ahead of the game? You've got your scarf on today.
Yes, well, fingers crossed, and I have invited the New South Wales Premier will be invited anyway, but I've also said he should come up here and, game on Wednesday. So fingers crossed for Queensland. Okay? Thanks everyone, better go and turn this side, hey?